Hi everyone, hope you're doing well. Welcome to Spill the Beans. My name is Duncan Goldie. My guest this week is Ahmed Shahrabani from Locums Nest. Ahmed is a qualified doctor. He's worked at the Royal Surrey County Hospital in Guildford. Graduated from University of Sheffield in 2014 before accepting his first medical post at St Heliers Hospital. He met his colleague there and co-founder Nick. Nick and Ahmed stood back from frontline medicine in 2016 to basically go full-time with Locums Nest. Locums Nest is a staffing management platform, so when they were working on the front lines, they kind of saw the difficulties and issues within the NHS when it comes to locum staffing, having to rely too much on agencies and obviously incurring the cost which comes with that. So they took the mission upon themselves to create an innovative new platform and basically solve the NHS staffing crisis by empowering clinicians and NHS staff to kind of take it upon themselves to work in across trusts and not just be siloed into the one. So they're basically now spread across every healthcare specialisation, and they've saved over £60 million for the NHS just in the first 3 years, and they've got a very strong ambition of saving £1 billion by 2022. So definitely a really interesting chat with Ahmed to find out a bit more about the history, but also the vision that they've got for the collaboration within the NHS. Cool, Ahmed, thank you so much for taking the time to feature on the Spill the Beans podcast. Tell me, whereabouts in the world are you right now? Where are you based?
Duncan, thanks for having me. I'm based in sunny little North London in Islington at the moment, the home office.
Lovely. And what's the working from home setup like for you? Have you been able to kind of adjust and keep things going pretty much the whole time?
Yeah, Duncan, the thing I enjoy most in life / in working life is going out and meeting people. So for me, this was a bit of a hit. But no, I've gotten used to it. I've got my setup at home. I've got my artwork, which is pretty out there. I've got my Lego car collection on the left, and various bits and bobs. But we still keep in touch with the team a lot. We still have that social element to it as much as we can remotely. And on the weekends I'm on the ward, so I get my human face-to-face interaction with colleagues and patients alike. So it's a nice little balance.
Yeah, good. So it's always good to have little side projects going on. Did you say that artwork, is that stuff that you created yourself, or is that you collected?
Far from. Art is probably my weakest point. I have very little knowledge about art, and my ability to draw is limited to kind of noughts and crosses. So we'll leave it as that.
But yeah, I mean, it is always good to have a little side project going on as well when you're at home in lockdown as well, then keep busy. But I'm surprised you have any time for anything else, because obviously as the founder of Locums Nest, or the co-founder of Locums Nest, and still a practicing medical doctor, doesn't seem like you would have too much spare time or mental energy for anything. But before we get stuck into Locums Nest, which we will go into in quite a lot of detail, what's the story of yourself? I mean, prior to being a successful entrepreneur, what was I suppose your kind of professional history?
So where do we start? So I was born in a beautiful country called Oman, just in the Arabian Gulf, borders the UAE and Saudi Arabia. Grew up there, went to a British school there. Great country, great people, and I think that really kind of carved out my kind of personality and career choice. Then moved up to Sheffield to do my med school degree. Sheffield was the closest thing to Arabia in terms of people's friendliness levels and kind of that sense of community. So went up to do med school in Sheffield, and then ended up coming down to London and Surrey to my foundation training. So did my FY1 year at Epsom St Helier in South London, and then moved to the Royal Surrey to do my F2 year. And then over the next 4 years, that's when Locums Nest happened, and we'll go into that and kind of the genesis of that. And then since February, March this year, the onset of the pandemic, I've reinstated my license to practice and have been on the wards most, if not all, weekends since COVID, really. So I've got this kind of hybrid life of Locums Nest during the week and doctoring during the weekends.
Yeah, definitely. Well, you definitely don't have much time for anything else then. So, I mean, talk me through the kind of early stages just prior to Locums Nest, being created. What was the kind of driving force behind that?
Yeah, so really it all started in St Heliot's, our FY1 year, and it was there where I met Nick, who's the other co-founder of Locums Nest. We both worked together in the same surgical firms. It was us and a few other friends, still very, very close today. And really it was like clockwork. Every Friday, rota coordinator would come down and say, Ahmed, Nick, Sarah, Paddy, do you mind picking up a weekend shift this Sunday? We'd often say no because we were rotated to work on the Monday, or because we were F1s at the time, and we were slowly gaining confidence and ability to work kind of weekend shift and on calls. Failing that, it'd be a real nice kind of cocktail of consultants coming down twisting our arms, and if that wasn't successful, it would be a barrage of phone calls, emails, texts, bleeps, asking basically us and the rest of the hospital if they could pick up the shift on Sunday. Failing that, the rota coordinator would then go out to locum agencies, and it would be again a barrage of phone calls, emails, texts, and if a doctor was found, great, but at what cost? So it was a long process. It was a convoluted process. It took time, and it turned out it took a lot of money. I mean, we did some research. Nick was an academic trainee, and we found out the problem cost £4 billion a year, and this was just before the NHS improvement came out with the 3.7 billion. So actually our 4 billion was pretty good, pretty lucky. We got the right number. So we thought this is a problem, that we're feeling at hand, but it's also a problem financially because the NHS is hemorrhaging money on a process that's been solved by, excuse the blunt analogy, the dating industries, the travel industries, the taxi industries. It's simple disintermediation. You connect professional or service provider with where he or she is needed. So we then took that idea away and thought, how do we build this? And this was before anything else was out there. It was still the days of emails and phone calls and stuff to book into your shifts. And we went away and we designed a pretty app. It went through lots of different names and lots of different logos. Eventually we found the owl, which everyone loves and adores till today. But what happened was we took this idea and we kind of worked on it in all of our kind of spare time during our FY1 years, which you don't get too much actually as an F1 doctor. You're really thrown in the deep end. And then in our F2 year, I moved to the Royal Surrey, Nick moved to St George's, and we took the idea to the deputy HRD at the Royal Surrey at the time, a lovely lady called Nikki Hill, really, really supportive. She kind of helped sprout the seed of Locums Nest. And we went to Nikki and said, Nikki, we've got this idea. It's not being done anywhere else in the UK. It could really make an impact. And she said, you've got my blessing. Start small. And then with the Royal Surrey, we started deploying it at ENT, small department, lovely consultants, lovely staff. Made a real impact in ENT in 4 months and proved that. And then we started working very, very closely with the other departments at the trust. And then soon we started working with Ashford St Peter's neighbouring trusts. And I think that this is one of the real key things for us is as soon as Ashford St Peter's, their HRD and deputy HRD and head of temporary staffing came on board, immediately we all sat down in a room together and said, for 70 years or 68 years back then, the NHS has operated in silos and everyone looks after themselves, which is right to kind of many degrees. But, the N in NHS stands for national. So why don't we try and, break the status quo and actually work together? We'll let our doctors work at your hospitals and we'll let your doctors work at our hospitals. And we're sure the technology can handle that. And, we said, of course the technology can handle that. It's not rocket science. So right from the very, very beginning, collaborative working, sharing of staff banks, sharing of resources, sharing of best practices was in our kind of blood and DNA. And, I've been to many talks and I don't know who the original author of this saying is, but everyone seems to claim it's theirs. But the whole saying of, there are more pilots in the NHS and the RAF and British Airways combined. And we tried to move away from that and get people to work together and share practice. So right from the very beginning, in the first year of Locums Nest's genesis, we created a kind of collaborative bank where 2 trusts worked together and supported each other. And the impact was huge, from kind of increasing the fill rates and staffing levels at the wards to improving, average length of stays, doctor and worker satisfaction, and, saving money is a byproduct of all this. So the system very simply did its job back then. And back then we only had 2 trusts and probably 500-600 doctors. We're at a position now where we've grown substantially across the NHS. 30,000 doctors plus on the system, 30 plus trusts, and hundreds of GP surgeries are all using it across multiple countries in the UK. But one key theme that we try and stick to at Locums Nest is collaboration. But whatever the current foundation is of the NHS organisation, wherever they are, everybody needs to work together down the line. Controversially, we've lost deals almost on purpose from speaking to trusts who were against this idea of collaborative working. They would approach us and they would say, we want the system, but we don't want to share anything with anybody. And it seems crazy for a startup to say, no, we don't want you on board, or we can't have you on board, I'm really sorry, unless you're open to working together. It's like putting a noose around a startup snake. You're cutting their blood supply to let them grow, but principles and kind of customs and ways of working are paramount to us. And really what's great to see is NHSIE are now also pushing this collaborative working agenda, and it's great to see. As I said, it's paramount.
100%. And I mean, in terms of the benefits that come from that, you obviously mentioned a lot in terms of staff satisfaction, fill rates, cost savings and things like that as well. But more from an individual level, you're obviously still a practicing medical doctor as well. And can you tell me a little bit more about, what you're kind of seeing as the feedback from, clinicians that are using the platform, being able to go outside of just the one, center where they were working previously?
No, yeah, and of course, as one of co-founders of Locums Nest, I'll tell you the feedback is good, but I'll tell you why it's good. It's easy to say it's good. So, as I said, since the onset of the pandemic, I've gone back onto the wards, and it was a really, really rapid learning curve to get back up to speed with medicine. It evolves so quickly, and I was away for a couple of years, and really kind of thrown in the deep end. And I did my bits, I did my reading, I did my research, I did my training courses, everything before going back on. I did various shadowing. But speaking to the doctors and the nurses and the healthcare professionals, there's one thing about working with staff who know how things work. But the other thing is, I'll just use a doctor as an example. We work with all worker groups, but just sticking to doctors, they appreciate more than anything to be able to do their job without kind of undue interruption. And one thing that Locums Nest does, and we built this for this, is it puts the doctor in control. It not only in terms of how often they get notified via the app, but more crucially about how and where they work. And of course there are rules. There's a GP doctor training contract, there are trust policies that they all have to adhere to, and the app does that, no problem. But it's, if I was a junior doctor at the Royal Owl Hospital and I was a cardiology SHO, and I had a week of free time that I wanted to do extra work. I wanted to work under a said consultant that I didn't have the opportunity to do normally. And said consultant was working at the Royal Stork Hospital. Historically, I would have had to, historically, I wouldn't even have known that the consultant that I admired was working at the Royal Stork Hospital, because there was no transparency. And the only way to do that was to go via a locum agency and kind of navigate that way. And then at the end of the day, the NHS would have to pay an agency commission, and also I would get my money and a bit taken out of my paycheck for that. But what we try and do is we allow the doctor to see that his or her kind of consultant they want to work under is over there. They have to see if his or her own trust don't need a cardiologist SHO, i.e. them, on those dates. And if their hospitals are fully staffed, then why would we even consider not letting that doctor work at the Royal Stork Hospital under their consultant to gain more experience, to become a better doctor, to have higher levels of satisfaction and well-being, because they're getting what they want. They feel in control, they have that autonomy. So that's what we're doing. The doctors like it because they have the control, and they feel like they're helping the NHS, and they feel like they're helping the NHS without costing the NHS anything. They know every penny they earn goes to them and not to an agency. And there's that real sense of kind of, I don't know, self-justification or kind of feeling of doing good for the NHS that's really valuable to them.
And trust has got to be huge, right? In terms of, both from a clinical perspective, from, commercially viable perspective with the NHS. It seems at the moment there's such a wide range of digital health innovations happening within the NHS, because I don't think it's any secret to anyone that the NHS has experienced quite a few problems and has quite a few deep-rooted problems within the NHS. But particularly around that area with collaboration, it seems to be quite an obvious solution, and quite a sort of, one with very few cons, and many pros. But there has to be some kind of resistance almost in terms of that collaboration. You touched on it briefly before, whereby it's a very traditional organization, and the N in NHS being national sometimes is a little bit ironic in terms of the processes. But I mean, are you seeing a shift in that with the other innovations that are coming through as well? And is that benefiting you, or are you very much sort of treading your own path and being on the front lines of that, do you feel?
Yeah, so look, there's two points there, I guess. The first being the kind of resistance to collaborative working, and what kind of the DNA of those problems. And then the second is, I guess, the NHS, it's perceived issues, and how it overcomes that, and the kind of complexity of the problem. So the first problem about kind of, not problem, but the first kind of hurdle where we have to address when kind of deploying collaborative banks is really reaching the right people. It's collaborative working isn't a technical problem. And a lot of tech suppliers and companies will make it very complicated on purpose. And this, I still don't understand it to this day. It might be some form of weird and wonderful self-gratification. I don't get it personally. But it is a simple problem technically. The complexity is the cultural change, because this isn't a problem that you're putting a patch on just to fix it for a day, that you're changing the way people work for years, if not decades down the line. So it's about the culture. And to change culture, it's about the people. You need to get the right people on board. And, yes, on one hand, it's become much easier for us to deploy our solution of collaborative working, because we now have hundreds of thousands of shifts worth of data over the past 3 years of the collaborative bank running, which we can just show. And so, your concerns of ABC are addressed by DEF data points in the hundreds of thousands, and it's, statistically relevant and correct. But it's about reaching the right person. It's about reaching that kind of brave or bold chief exec, HR director, medical director, nursing director, whoever they might be, that shares the vision of kind of NHS sustainability into the long run. And once you've reached them, the clouds start to move away, and you start to see kind of the sunny skies, because things just start to work. But trying to force something with somebody who doesn't want to do it or doesn't believe in it wholeheartedly, you're destined to fail. And I would just say to people who are trying to do this that, it might just be a timing thing. The timing for that isn't now. So focus on battles where you can win. The second point you mentioned was the kind of complexity, or the kind of the difficulties the NHS faces. And one thing I feel very strongly about is the NHS has great staff. The workers in the NHS right across the board, from junior to most senior, are very hard workers mostly. And people try and take away from that. And actually, we feel very strong about Locums Nest is giving every single person that you kind of have contact with a tool to support them, to make their life easier, rather than trying to take over their life and replace them. So every single facet of Locums Nest, from the data intelligence, from the shift management, from the interoperability to the collaborative working, to the HR side of things, is built in conjunction with the person who is using it. So we'll have various work streams of various people, various focus groups, where they'll say, I want it to do ABC or 1, 2, 3. We'll usually say yes within reason, but of course give our feedback, because it's, as I said before, it's best not to try and reinvent the wheel. We've done this across 30 odd trusts now, and you start seeing really good practice, and you start seeing practice that can be improved. So it's empowering the user is infinitely more important than trying to dictate to the user. And I think that's a lesson that a lot of people will learn very soon.
Yeah, absolutely. And it seems to be, such a critical moment within the NHS as well to impact this change. And, I feel like a lot of the senior positions within the NHS are historically, risk mitigators rather than innovators. So to be able to introduce these solutions to them and have that, I suppose, common collaborative theme where everyone's on the same page and you're doing as much as you can to help the frontline staff in primary care, then that's going to be huge impact for both the clinicians and the patient care as well.
Absolutely. I think, sorry to interrupt.
No, absolutely, go on.
So I've got so much respect and time for Purina, so the new chief people officer at the NHS. She's really driven an agenda that focuses on kind of the people that matter, the workers, and that is so in line with what we're trying to do. And that's having knock-on effects with trust leaders all across the country. And I can be more thankful enough for her direction in all this. It's really made the path of innovation much easier. But sorry, Duncan, you're saying.
No, absolutely. I mean, that's great to hear that the senior positions are, their mentality around things are starting to change as well, and that's sort of feeding down into the impact that you can have. I guess that kind of centers around my next point, which was going to be, what does the future look like then for Locums Nest? What's the kind of goals that you can tell us about?
Yeah, so of course we started this journey with the doctors. We're now working with every single type of healthcare worker in the NHS across so many different geographies in the NHS, and it's amazing how different parts of the UK is. I think I could honestly write a book on kind of quality of coffee at different hospitals. I think I've probably been to most, if not all, hospitals by now, at least across England, Wales, and Northern Ireland. I've still got to kind of conquer Scotland, but we'll get there. But we want to create a world where there is kind of total workforce mobility. If the NHS needs a doctor or a nurse within the organisation, and there is another doctor or a nurse or a healthcare physician or whoever they might be at a different NHS organisation, we want to create the path of least resistance for them to be able to support one another. And that is a world where there are no more silos between the NHS. We operate in a totally transparent way. We will end up saving billions of pounds, undoubtedly, because we're still paying about £2.5–3 billion a year on agency costs and inefficiency costs, so compound that. But yeah, in one line, it's absolute total workforce mobility in the NHS, and re-emphasising the N is national, and we will do that in time. It'll be one NHS, one staff bank.
Absolutely, perfect. Well, look, Ahmed, we're pretty much out of time here. If anyone does want to find out a little bit more about Locums Nest and the team and the good work that you're doing, what's the best way for them to do a bit more research?
So the guys done a phenomenal job with our website. There's loads of resources there about various challenges that we face and how we overcame them. There's kind of various lessons learned. Equally, I'm personally very happy to be contacted either via my email. It's very simple, ahmed@locumsnest.co.uk, or on LinkedIn. And any of my colleagues are, we're all very happy to help answer any questions that anyone might have.
Perfect. Well, I'll put those links in the summary of this podcast as well, and I'm sure the conversation will continue because it's a fascinating subject, and it's great to see these kind of solutions coming out, and no doubt relative to the success that you're experiencing as well. So thank you so much for taking the time, and enjoy the rest of your day.
It's a pleasure, Duncan. No, thanks for having me. Have a good weekend.
Speak soon. Cheers. So that's all we've got time for this week then, guys. Thanks very much to Ahmed for taking the time out of his busy schedule to chat with me. Really interesting to hear from him and hear his perspective on the NHS overall and the good work that he's doing to kind of bring everyone closer together. So I really like the point that he raised as well about the N in NHS being national, and a big problem which I think a lot of people who work in and around the NHS see is the kind of distancing between different sites. And so his vision of bringing it all together is really an important one, and I think something that resonates the whole sort of message of his ethos behind Locums Nest really well. So if you do want to find out a little bit more information, then feel free to have a look at the summaries that I've put in the summary of this podcast, and you can get involved and find out a little bit more about Locums Nest, and also find out a bit more about Ahmed through his LinkedIn profile there as well. So until next week, hope you're all doing well and stay safe, and I'll see you soon.
Spilling the Beans Digital Health Podcast is aimed at members of the digital health community globally. with guests from the United Kingdom, Australia and the United States. The podcast is available through all major podcast distributors as well as on YouTube. The show is sponsored by Woodrow Mercer Technology and